Welcome to part 1 of nursing practice questions and answers about musculoskeletal problems of the adult clan. Now let's start with the first question. The nurse is conducting health screening for osteoporosis. Which clan is at greatest risk of developing this problem? So these are the options. Option A, a 25-year-old who runs. Option B, a sedentary 65-year-old clan who smokes cigarettes. Option C, a 70-year-old clan who consumes excess alcohol. Option D, 36-year-old clan who has asthma. Now for this question, the correct answer is option B, a sedentary 65-year-old clan who smokes cigarettes. Now let's move to the rationale. Risk factors for osteoporosis include the following. 1. Sedentary lifestyle. 2. Cigarette smoking. 3. Advanced age. 4. Excessive use of alcohol. 5. Insufficient intake of calcium. 6. Gender. Now let's move to the second question. The nurse has given instructions to a client who sustained a ligament injury who is returning home after knee arthroscopy. Which statement by the client indicates that the instructions are understood? So these are the options. Option A, I need to report a fever, redness around my incision, or persistent drainage to my healthcare provider. Option B, I can't eat food for the remainder of the day. Option C, I need to stay off the leg entirely for the rest of the day. Option D, I can resume regular exercise tomorrow. The correct answer for this question is option A. I need to report a fever, redness around my incision, or persistent drainage to my healthcare provider. Now let's move to the rationale. After arthroscopy, the client usually can walk carefully on the leg once sensation has returned. The client is instructed to avoid strenuous exercise for the length of time prescribed by the surgeon. The client may resume the usual diet. Signs and symptoms of infection need to be reported to the primary healthcare provider. Finally, let's move to the third question. The nurse witnessed a vehicle hit a pedestrian. The victim is dazed and tries to get up. Her leg appears fractured. Which intervention would the nurse take? So these are the options. Option A, try to reduce the fracture manually. Option B, assist the victim to get up and walk to the sidewalk. Option C, leave the victim for a few moments to call an ambulance. Option D, stay with the victim and encourage the victim to remain still. The correct answer for this question is option D. Stay with the victim and encourage the victim to remain still. Now let's move to the rationale. With the suspected fracture, the victim is not moved unless it is dangerous to remain in that spot. The nurse will remain with the victim and have someone else call for emergency help. A fracture is not reduced at the scene. Before the victim is moved, the site of fracture is immobilized to prevent further injury. Now, in my presentation, my reference book have used Saunders' Comprehensive Review for the NCLEX-RN Examination 9th edition.